Access to health care could be a significant campaign issue in that election. Overstretched hospitals, a major concern nationwide. Tonight, CTV's Kathy Lee brings us the story of a cancer patient in Alberta who was transferred to a storage space for 24 hours and where she says she struggled to find even the basics.
Over there that I have to follow.
Orders from the doctor includes pain medication to help Rose Roll manage as she battles cancer in her bone marrow.
It affects my immune system. I get a lot of bone pain with it.
Her suffering magnified at the Chinook Regional Hospital in Lethbridge, where she was undergoing treatment and was moved at the tail end of her week-long stay.
They said, well, a much sicker person needs my room and that I would be going to a storage room.
This was the room, half filled with hospital supplies. Roll says it was dirty. She didn't have her own sink, shower, or toilet. She needed to find a clean bed sheet and at one point had to buy water.
I definitely felt forgotten. I was really sad. I felt like inmates got treated better. I felt really demoralized.
A patient advocacy group says Roll's experience speaks to a wider problem with the healthcare system, not just in Alberta, but countrywide.
It's a hangover from the pandemic. It's something that continues across the country, and I don't think governments have done enough to address this ongoing problem.
Alberta Health Services says it apologizes for what happened, saying the hospital is currently experiencing high patient demand and the unit Roll was in is under a respiratory outbreak, and that they have removed the shelving unit and cleaned the room. Roll says cleaning is not enough.
I would like that storage room to be strictly a storage room and for them to never put a patient in there again.
Not just for the sake of other patients, but in the event she needs to return for cancer treatment in the future. Kathy Lee, CTV News, Calgary.